Hi, welcome. Today I'm going to be doing a full back massage. I'm going to include a little bit of glute, and I'm going to be working on the lovely Lauren. And I'm going to go ahead and dive right in. So getting started, I'm going to go ahead and start with these glutes. I'm going to do some really simple compressions. And I'm going to go right in with my elbow, but I'm not going to use a whole lot of pressure to start. So it's definitely a misconception to think that just because you're using your elbow, you need to, use a lot of pressure. And I'm going to do just some gentle shaking at the same time as I do these compressions. And starting with a medius, and I am going to work my way into that glute max just for a minute or two. And I find that just doing these compressions in the glutes to start kind of helps the low back to release. And that tends to travel up the back. And ultimately just saving myself time and energy by sequencing things in a smart, intentional way. This distraction technique is really nice, especially for people that don't tolerate deeper pressure. Kind of include that light shaking, just a small movement when you're holding these compressions. Not rushing, but not taking too long. And always when you're closer to the table and your client, you want to make sure that you widen your stance so that you're not putting unneeded pressure on your back. And I'm going to go ahead and just work around this SI joint along this iliac crest and just encouraging these hips to soften. If I feel like the SI joint is a little bit stuck, I might do a little bit more shaking, just really encouraging that joint to soften, relax. But if someone has like a really sharp pain, I'm very careful about just actually wouldn't even do shaking. Gotta look out for those contraindications. And just starting to warm up this right side of the back. Gonna be focusing a lot on the erector spinae and the traps. And it really is the worst when you go in for a massage and your therapist kind of doesn't warm up properly. It's just not very pleasant. Sometimes I really like to kind of hinge my forearm around the scapula It's just a nice way to warm up the traps without it feeling too overwhelming. And just doing the same warm up on the left. I have worked on Lauren several times, so I have a pretty good idea of just areas of focus. And I'm going to give a little bit more attention to this left low back and hip. Anytime that you're doing a hold with that shaking, you just want to make sure that you feel like you're on the muscle belly so that you're not going to slip off. You do need to pay a little bit more attention when you're going in with your elbow, because it is easy to kind of press too hard too fast. So just you definitely need to monitor the amount of pressure that you're using. More focused on the medius than the glute max, but I like to do a little bit of work on this big muscle. It's pretty surprising how much tension most of us hold in our glutes, especially this big glute max. It's definitely a place where we can carry a lot of stress without realizing it. And I'm really using the whole surface area of my fingers. So just nice broad surface areas. I work over this bonier part of the body along that iliac crest, just making sure it doesn't feel like I'm jabbing Lauren in her bone. It's never a good feeling. And just some really simple compressions along the erector spine. And just starting to work my way around the scapula. If you're working on a smaller person, sometimes the forearm can feel a little bit too big or bulky. And so if you want to warm up the traps, you can always use the pads of your fingers or your thumbs. And it doesn't have to be fancy. You can do little circles, just warming up the soft tissue. And if you're confused about what to do, if you're new to massage, just working your way around the scapula is a pretty safe bet. You're working on the trapezius muscle. And I am ready for my oil. So today I'm going to be sure to work on these erector muscles, and I want to pull these muscles away from the spine and also towards the spine. Some different techniques I'm going to use. And I'm going to focus a lot on these upper traps as well. And just starting with broad effleurage stroke. As that oil starts to settle in, I'm going to apply a little bit more pressure. The heels of my hands. So some things that you want to kind of look out for is if you feel heat underneath your hands in certain parts of the back or puffiness, it usually means that there's inflammation, and if there's a lot of it, you don't really want to work on that area. Lauren has a slight curve in her spine, and so her erector muscles are not really the same on each side. So just being a little bit more careful when I'm working along those muscles with anybody that has any type of curve in their spine. And one way that you can, if you're feeling a little uncomfortable, this is a really nice way to just do a mental scan of the line of the spine. You can go in a little more confidently. You can get familiar with where the curve actually is. And just make sure that I have plenty of oil on my forearms. Especially when you're going to be using your elbows along the spine, you want to go in really confidently. And working my way along these lats and the erector spinae at the same time, also into the hips. This is one of my favorite techniques for doing work in the lats. And I'm going to start working my way into these erector spinae, just really encouraging more mobility by moving these muscles away from the spine and offering some cross friction. If you're working on someone that has a curve in their spine and you're not feeling totally comfortable or confident in your approach, I would say this technique is really safe, and I wouldn't worry about working in towards the spine as much. You can do this with your thumbs as well, but I think it's a lot harder. And one of the simplest ways that you can change directions and start working towards the spine is just with your forearm. So it might look like I'm pressing down, but I'm pressing more in. And I'm gonna start to use more of the base of my elbow if Lauren is wanting more pressure. So pressing more in than down. And I'm gonna kind of shift my focus into this trapezius muscle. I'm just gonna open everything up and just doing simple things like changing the position of the arm can make, your work as a therapist a lot easier. Just opening up that trapezius and can't forget about the rhomboids. I usually find a lot of trigger points, especially in the upper trap. Holding for maybe 5 seconds. I'm just trying to keep things as fluid as possible in the middle of the trigger point work. And starting on this left side, need to move. Because I know Lauren tends to get fairly tight in her left low back, I'm just doing a little bit more in this medius. And you can use one fist if that feels more comfortable. This is a pretty safe bet if you're working on someone that gets ticklish. Usually feels pretty good. And you can certainly knead with your elbow if you want. And when I start to find these trigger points, I'll hold and then continue a nice fluid stroke into that muscle. if I were to just kind of press and pick up, it just wouldn't feel as nice. And I'm going to go ahead and wrap up this massage with a few nice effleurage strokes. I'd like to thank a few of our patrons: Mad Cat 256, Andrew G, and Alice with an S. Thank you guys so much for your support. And that is all for today. Thank you for joining us today. I hope that you enjoyed today's video, and I look forward to seeing you next time.
If you enjoy these videos, please join us at PsycheTruthPatrons.com for dozens of exclusive videos and premium programs. We have over 1,000 videos you won't find on YouTube, such as modeling and fashion hauls, exclusive massage videos, ASMR, behind the scenes, bloopers, and much more. It's a great way to help us keep the cameras rolling so we can continue making the content you love. Patrons will get 2 to 3 new exclusive videos each week, so I hope you'll consider joining our Patreon family today. Just visit PsycheTruthPatrons.com.